to go? Yep. There are 20 new cases of coronavirus reported overnight. They're all local cases. 14 of those were in isolation throughout their infectious period. 15 of those cases are linked to current outbreaks. However, there are a number of mystery cases and cases that are still being investigated. That really is the most important number. The fact that outbreaks that are already challenged by the fact that we can't determine where the original source, where the index case was and how they got it, and the fact that through information overnight, through these results overnight, we have added, in fact, to the number of mysteries, the number of unanswered questions out there. That's why, sadly, today the Cabinet of the government, we have met and we have determined to accept the advice of the Chief Health Officer to extend for a further period of 7 days till 11:59 p.m. next Thursday. This is very challenging, I know, for every single Victorian who would like to be going about their business. I'd like to be open and have a degree of freedom that's simply not possible because of this Delta variant, the extreme infectivity of this virus, and the fact that within a very short space of time, if we were to open, then we would see cases akin to what's happening tragically in Sydney right now. So if I could just go through a few of the numbers of the day though. So the 20 cases I've spoken about, 41,571 test results received overnight. So again, I thank each and every one of those more than 40,000 Victorians who got tested yesterday. 98% of results are coming back the following day. So if you've got symptoms, you must get tested. Appealing to, no matter how mild the symptoms are, you must get tested and you mustn't wait. You must get tested as soon as possible and know and be certain that we will get your results back to you the following day, and we'll support you no matter what the result of those tests. 23,811 people were vaccinated yesterday. We've seen really strong uptake in those extra AstraZeneca, those additional AstraZeneca appointments that we bought online, and the eligibility expansion from 18 to 39. The drive-through site's working very well. I can, not today, but quite soon we'll be able to speak to further expansions of the AstraZeneca program, further expansions of our hub model, so that we can get even more people vaccinated over the coming month or so. It's very important. As the Chief Health Officer said yesterday, the best vaccine is the one that you can access today. That makes a huge contribution to us getting to the other side of these lockdowns, getting to the other side with a very different set of rules. So we thank everybody who's taken us up on that offer and booked and been part of that expanded program. Just to give you an example, in the last 24 hours there's been something like 7,000 AstraZeneca bookings and over 30,000 Pfizer bookings. That's a massive increase in the AstraZeneca bookings compared to where it was a week ago. So even in just a few days, we've seen thousands and thousands of Victorians access that AstraZeneca or book to access that AstraZeneca vaccine because we have made it available through an informed consent process. Just one further announcement. As you all know, we have a border bubble that operates on the border with New South Wales. There are 6 reasons where that you can use any of those reasons to move within that border bubble. It's very important, though, that we not only limit movement, but that we have the clearest picture of who is moving within that border bubble. So from 1 p.m. tomorrow, but not enforced until 6 p.m. Friday, people will need to, if they want to use that bubble, they will need to get a permit and they will need to apply for a permit. It's a relatively straightforward process. We'll be doing lots of communications along those border communities so that people know, but it's not good enough to limit movement. You need to know who's moving. And before anyone says, oh, why would you do that? If this virus can get from Sydney to Byron Bay, to Dubbo, to Armidale, to Tamworth, then only a fool would think that it couldn't get to Albury. It absolutely can, and that's why we need to go beyond just a bubble. We need to have permits so that people can apply once, have their permit, and then we have a clear sense of who is moving within those border towns. Logic tells you there's every chance that it comes to those southern New South Wales communities, and then there's a potential risk to coming into Victoria. We need to have as much information as possible about who is moving in that border bubble. As I said, those permits will be available from tomorrow. But we won't enforce that. We'll give people time to apply. We won't enforce that until 6 o'clock Friday evening. I apologise for any inconvenience, but frankly the inconvenience of having to get a permit is nothing compared to being locked down or having cases in an outbreak in communities that have never had an outbreak before. The situation in New South Wales is very, very challenging, and with hundreds of cases now, thousands of active cases, and the fact we have seen movement well into regional New South Wales, we have to assume that that is going to be a feature of that New South Wales outbreak for some time. All in all, I'd love to be standing here announcing that we're coming out of lockdown this coming Thursday. That is simply not possible. We need to go until next Thursday. That is the public health advice. There are too many cases, and too many cases the origins of which are not clear to us. Too many unanswered questions, too many mysteries for us to safely come out of lockdown now. This is working though. It is more than containing cases. To have 14 of those 20 locked away in ISO, no risk to public health. As I said earlier in the week, that trend would grow. We started with 1 case, then we moved to 4 or 5, now we're at 14. That percentage is growing, and it will continue to. But some of these new cases today and the potential chains of transmission that sit behind them, and the fact that we are getting further mysteries, not just the original 2 mystery cases, but further mystery cases, that is a real concern to us. That's why I can only appeal again, every Victorian, whether you're in Melbourne or in regional Victoria, if you've got symptoms, get tested and don't delay an hour, let alone 3 or 4 days. Please go and get tested today. We'll get your results tomorrow, and then we'll protect you and look after you and support you no matter what the outcome of that test is. In terms of the rules, they are incredibly important. They are about saving lives and getting us to the other side of this, and I'd appeal to all Victorians to follow those rules, use common sense, make the best choices for your family and every family. And can I thank and congratulate the vast majority of Victorians who are doing that. It makes you very proud to see so many people doing the right thing, not just for themselves, but for everybody. Whether we like it or not, we are all in this together until we get the community through the vaccination program. That is still some months away. But it's very encouraging that there's been strong uptake of the expansions we announced on Sunday. And just foreshadowing, not today, but in the next few days, I'll have some more exciting announcements about the important opportunity and the absolute likelihood that many hundreds of thousands more Victorians will be able to access the vaccine over coming weeks. I now might ask Jerome to speak to individual cases and the outbreaks. Then the Chief Health Officer might speak to his advice and the reason why it's so important that we extend this lockdown, as disappointing as that is, and then we can take any and all questions you have.
Thank you, Premier, and good morning. So 20 positive cases today. There are now 118 active cases of coronavirus here in Victoria, associated with both hotel quarantine and this cluster. 100 of those cases are associated with the 2 chains of transmission we're working on at the moment. There is 1 case currently in hospital, and they are not in ICU. And of course, we extend our best wishes to everybody recovering from coronavirus here in Victoria. We have around 13,800 primary close contacts in total. That's an increase of 1,700 from yesterday, associated with the ongoing detective work around a number of new sites of exposure. 291 exposure sites now on our system, active exposure sites. We did take off 1,000 primary close contacts yesterday as we continue to exit people from their quarantine through that structured system of day 13 testing and then the release process. With the 41,000 or so test results received yesterday, that now takes us to 250,000 tests over the last week, the first week of this outbreak. Those tests coming back 91.6% of the time within 24 hours. Can I just thank everybody who's come out to get tested? We are seeing an uptick in the last few days, which is very encouraging. 250,000 tests over the last week is a good start. We need to continue that trend as we work on a number of active fronts of this outbreak. Similarly, over the last week, we have vaccinated 236,651 Victorians through both the GP system and the state clinics. It's, as the Premier said, good to see people coming back to really come forward and get vaccinated. More AstraZeneca slots are opening up. There are still some Pfizer slots available in our systems, and we continue to make more slots available whenever we get more vaccines. So please continue to check. Getting ourselves vaccinated is the way we get through these outbreaks. In terms of the 20 new cases overnight, One of those is a student at Altaqua College, and 5 are household members of other students at the same college. That takes us to 6. All of those were safely in isolation. We have 5 household contacts from students at Mount Alexander College. Again, all were in isolation. That takes us to 11 for the day. We have 4 cases associated with the Caroline Springs Shopping Centre, and I'll come back and talk more about that in a moment. 2 of those associated with the Jolly Miller Cafe, 1 with the YPA Estate Agency, and 1 with Edwards Sourdough Bakery. Some of those cases were in isolation. 2 of those cases were in isolation. The others were still active in the community. We then have 5 new cases that are not currently linked, although we have got some good information to work on, and we're confident we will link them in the coming day or 2. 3 of those are a family from Melton, from the city of Melton, 2 parents and a child. The child was already in isolation as a contact of another primary close contact, but we do not currently have a direct link. However, I'll come back and talk a bit more about a number of exposure sites in the Melton area. And then finally, we have 2 cases, a father and a son, in the city of Melbourne. The son is a student, a grade 1 student at St Michael's Primary School. He was not at school whilst infectious, but out of an abundance of caution, we are, of course, going to test all of his classmates as Tier 1 exposures and the rest of the school as a Tier 2 exposure. His father is a healthcare worker who last worked at the Melbourne Children's Eye Clinic at the RCH last Monday, so a few days ago. We are, of course, contacting all patients and staff associated with that exposure site at the moment. It will be listed shortly. We will also be listing, as a Tier 2 exposure site, the Royal Victorian Eye and Ear Hospital, a small section of it. Again, some very limited exposure, we think, before the infectious period. But again, we are taking a very cautious approach with this Delta strain, as you would expect. We also, with these 2 new people, the father and the son, we have a couple of apartment buildings that we contacted people on last night. We will be regarding those as Tier 2 exposure sites, some Tier 1 exposure sites. They'll be getting tested today. A lot of activity for us there over the next day or 2. So if I look back over the last week, we started very firmly with a number of schools, 10 schools in this particular outbreak. We have now tested over 8,000 direct primary close contact associated with the various schools in this outbreak out of less than 9,000 primary close contacts. Fantastic support from all those school leaderships and for the schools community in coming getting out, and the majority of those need to continue to isolate for the full 14 days, and my thanks to the whole school community for supporting us in that. We have also had a number of conversations with the leadership group at Bacchus Marsh Grammar, and particularly the Madingley campus. We have asked, under the Chief Health Officer's direction, that Bacchus Marsh Grammar Madingley campus be closed today, and the school's leadership has agreed to doing this. And my thanks to them for their prompt and swift action. Bacchus Marsh Grammar, of course, was already involved in our outbreaks a few weeks ago, did a fantastic job in running those to ground. We know it's very challenging for the school community to see another closure of that campus, but given the high number of students that come in from the western suburbs, we've taken the precautionary step to ensure that those students continue with their online education, and my thanks to the whole school at Bacchus Marsh for supporting us in that. We have active transmission sites that we're really focusing on. We're confident that with Altaqua College and Mount Alexander College, although we've seen positive cases, we're confident we've got a very strong response in place, and those people are isolating well and delivering fantastically good testing results. We have over 90% of returns at the Newport Footy Club and at the Wolf Cafe, and again, those leads, although we'll continue to isolate, we're not seeing any more cases coming out of there. Our focus, therefore, now really moves to Caroline Springs Square Shopping Centre, where we've seen 29 positive cases already. We have declared as a Tier 1 site between the 2nd and 5th of August all the staff who work at the Caroline Springs Shopping Centre. A number of meetings yesterday with the council and with the shopping centre management. My thanks to all the retailers, the employers in that particular shopping centre. It is, of course, a very challenging time. But as we saw with Craigieburn Shopping Centre a few months ago, we really need to get to the bottom of any transmission we're seeing in and around that particular centre. We had a very good testing day yesterday, over 1,200 tests undertaken on site, a number of other tests in the wider area. We will continue that testing drive over the coming days. The second priority location for us is Melton, particularly the city of Melton, High Street of Melton and the retail areas in Melton. We now have 13 active cases in the City of Melbourne area. 6 of those are new cases today. We are doing a lot of work around Melbourne High Street, a number of retail sites. There are 13 exposure sites already listed. I expect to see more during the course of today. My call out to everybody who lives in the City of Melbourne or is using Melbourne as part of their retailing activity, please come forward and get tested if you have any symptoms or you've been to any of those exposure sites. Can I please remind people, particularly in the City of Melbourne and Caroline Springs, we continue to be under a metropolitan lockdown. It's important people only go out for those essential purposes and are not doing any other activity in the area. We continue to work at the Flemington Towers. Again, we're seeing a fantastic support there from the local community. I can confirm there are no positive cases in those buildings to our knowledge at this time. We have extensive testing going on throughout a number of those towers, and the levels on which people were, a number of those levels are getting daily surveillance testing every couple of days, as well as additional controls in place. We're working also at a couple of apartment buildings in the CBD where we have new cases living, and they will also get a combination of Tier 1 testing and Tier 2 testing, as well, of course, as St Michael's Primary that I've already referred to. 5 of the cases today are cases we were not aware of before they came through yesterday. We became aware of those cases because the people did the right thing. They got symptoms, they got tested. We have still wastewater detects in places such as Broadmeadows, Glenroy and Jacana around the northern and western suburbs. If you're living in those suburbs and you have any symptoms whatsoever, we need you to get tested immediately. We also have some wastewater detects in the southeast, in Keysborough. Again, the same applies. No matter where you live in Melbourne, in fact, no matter where you live in Victoria, if you've got symptoms, it's critical you get tested early so we can identify whether there are any other chains of transmission going on in this outbreak. Finally, over 1,000 people visited yesterday as part of our home visit programme. Again, very high levels of compliance, I think 99% levels of compliance. We also met 10 flights coming in from those red zones. I'll now hand over to the Chief Health Officer for his update. Brett.
Thanks, Jerome. As the Premier said, it's clear we're not in a position to release restrictions today. We do have more than 12,000 primary close contacts who are currently quarantining, and that number's growing every day. We've got almost 300 public exposure sites, that number also growing on a daily basis. And then the 5 unlinked cases today, which are always of concern. You can manage them, you can manage their close contacts, but they've gotten their infection from someone, from somewhere, and if that's not identified yet, then there's the risk of further people being exposed, and we're not able to manage that, to control those cases if we don't know where they are, and so that's a particular concern. That's a very different situation to what we saw in regional Victoria when we lifted restrictions for regional Vic. I'm sure that Melbourne will get to that in time, but we are not in that position as of today. We also know that for essential reasons, for authorised workers, there is movement across Melbourne metropolitan area, and so an issue anywhere in Melbourne is potentially an issue anywhere. We've got exposure sites that extend across the Melbourne metropolitan region. We've got cases that are not just confined to a couple of suburbs in the north and west. They really are quite extensively spread. I am confident we're getting ahead of it. With 14 out of the 15 linked cases today already with their entire quarantine period, their entire infectious period in quarantine is a really good sign, and I hope that continues. Jerome did speak about Melton. Our epidemiologists are working really hard to try and identify if we can link that particular family in terms of the shopping precinct or any other likely exposures. When we've got advice that provides that link or a particular exposure site that transmissions occurred at, we'll provide that as soon as we possibly can. But I also want to call out to the people of Melton, indeed Caroline Springs as well. If you are symptomatic, runny nose, sore throat, headache, fever, aches and pains, if you feel unwell, please get tested. There are busy queues in some places around the west, but look online, have a look at what the waiting times are. The showgrounds in particular has high capacity, so please get tested as soon as you can. That will be the way that we identify new chains of transmission, or indeed any of those chains of transmission that we haven't yet found. When we find them, we can control them. When we can control them, we can end those chains of transmission and we can release restrictions at the earliest possible time. In Melton, there's also the Djerriwarrh Health Services drive-through, so please bear that in mind, and we'll look to the activity of testing centres in the western suburbs to see how we can best respond to any of those demands. Finally, on border permits, the Premier spoke to the new permits on the border. We don't want any unnecessary restrictions on people in the border communities. We do want to protect them. We want to reduce the risk, and we want to be able to respond appropriately should any incursion into the border communities occur. We want them to go about their business safely. That is the key element here. The border permits don't change any of the reasons to leave home or the freedom to move across the border, but it does replace the ID check, and it means that the data that goes into Service Victoria, the same data that we get for every green zone, red zone, orange zone entry into Victoria, will apply to the border permit holders as well. And if there is an incursion, if we need to contact people, if we need to understand how people have moved in and out of Victoria, it'll allow us to respond quickly and effectively. And a quick and fast response means that we can get on top of outbreaks and lift restrictions again in the shortest possible time. So, essentially that new permit system, we hope it's not too burdensome. It will apply for a 14-day period, but it does mean that we can respond to any of those threats that, as the Premier pointed out, are continuing north of the border and will unfortunately remain a threat to the border communities for some time to come. Thank you.
Go over to take any questions you have.
Brian, do we know how many of yesterday's tests were actually conducted in the West? Because I know it was only 1% the day before. Is that number improving?
I'm not certain. We can come back to you though with our release later in the day if we can give you a breakdown on testing by local government area or region.
Sure, and we are seeing...
Obviously we would appeal to everybody. You can never have that number too high. That is one of the places where the virus is at the moment. We can't rule out that it's in other places. That's the nature of mystery cases. I see some people on the kind of at the furthest from Melbourne parts of the metropolitan Melbourne region, that which is declared Metro Melbourne. I just remind those communities, you mightn't have any cases now, but during last year, during 2020, we had the same kind of chorus of please let us be in regional Victoria, and only weeks later there were dozens of cases in some of those places. So that is the nature of mystery cases. We can't be certain where they are, where they've come from. Every mystery case, there's at least one other person who gave it to them, and these are cautious, these are conservative settings, but they're all designed to get us out of lockdown as fast as possible. Anyone, regardless of where you have been or where you're from, if you've got symptoms, please get tested, and please get tested as soon as possible, and we will get you your results back. 98% of tested Victorians are getting their results back the following day.
And we are seeing huge testing lines in the West. We're seeing people actually being turned away. So should we be concentrating our resources more into the West, considering that's where most of this outbreak is?
Yeah, we've got extra hours operating, we've got extra lanes. I would just say to people, thank you so much for coming forward, and particularly to those who have to wait some time to get through that process. I think Victorians understand, though, that you've got to do it in a very deliberate, a very methodical way. Like, the last thing we want is a testing site becoming a super spreading site. So we can't just have everybody bowling up. It's got to be done in a proper way, and it is, and that sometimes means people have to wait. So we thank them for their patience, and we above all thank them for the powerful contribution that them coming forward with symptoms and getting tested makes to our collective fight against this thing.
But given that those testing sites
in areas like Deer Park and Caroline Springs, given the numbers, given the fact that people are being turned away,
we constantly monitor how many. We've got more than 200 sites going at the moment. We've got all sorts of testing going on, new and innovative ways of doing it. For instance, those saliva tests, if not every day, then every few days in some of our public housing towers to keep an eye on things and make sure that there's no cases there. So we would never rule out doing more, but one of the reasons why sites are not it's not like drive-through fast food, because it's got to be very cautious and there's got to be the highest of infection prevention and control standards, and we don't want a drive-through or a testing site becoming a super spreading site. It does take some time, and we're deeply grateful to everybody who's doing the testing and those who are queuing.
Do we have enough boots on the ground, Premier, if these testing sites are being overwhelmed? Could we do with more staff there in Caroline Springs particularly?
Well, as I said, we've always employed, brought on, expanded with additional staff whenever we've needed to. That's something that's monitored every single day. Can I just say, it's a good problem to have, because you've got people coming forward getting tested, and I'm very grateful to them. But it is not like picking up fast food. It takes time, and it has to take time because it has to be safe. The last thing I want is people with symptoms coming forward to get tested as part of our public health response actually contributing to the spread of this virus. We've got to be cautious, and that's why it does take some time. But look, we look every hour, every day, and if there's more we have to do, then we will, and that's exactly what our record shows. We didn't start with 200 plus testing sites. We had many less than that.
Will more staff be put on today?
I'm not sure about that, but we'll monitor it closely, and I would just recommend that people go to the coronavirus website, have a look. There's many different testing sites, many different ways in which you can access the test. Not everyone has to go to the same site. You might travel a little bit further away from home, but get through much faster.
We're at a website right now. Western Health is over capacity. Melton's drive-through is over capacity. There's a 120-minute wait at IPC Health in Deer Park, 120 minutes at Mickleham Road, 120 minutes at Caroline Springs. Yeah. So is that? I know that's. You're saying that's good enough, it needs to be careful, but surely we can concentrate some more people there. Or what's your message to people that you want to go to the showgrounds then? Is that okay for them to go? What
Absolutely, it's fine to go to the showgrounds. There's a website, you can go to any testing site that the website indicates. There are more than 200 of them across the state. And I'm not for a moment pretending that people get tested within 1 minute of turning up. You'll never have a system like that. It's got to be done cautiously, it's got to be done carefully. There are some queues. If you want to know the details of those queues and how long it's likely to take you, go to the website. It'll detail for you all your options, and there are many options. In answer to the question, if there's a need for there to be even further options, then of course we will look to do that. But we don't have unlimited, highly trained staff. We don't have the opportunity to put a testing centre on every single corner. So we're very grateful to everyone who's coming forward. There will be some delays. That's the nature of this. We do everything we can to try and minimise those.
Premier, just on this issue of not having a never-ending supply of staff, the Ambulance Union Secretary Danny Hill is saying that paramedics were told last night to only transport patients to Sunshine or Footscray hospitals if it was a life-threatening emergency. It's saying that patients were being turned away from emergency departments because of a lack of staff who were furloughed as a result of COVID exposures. Is this getting out of hand in the city's west?
No, not at all. It's not uncommon. In fact, it's exactly what you want to do. If you're in an ambulance, you are far better to be taken to a hospital that has greater capacity to treat you quickly rather than going to one that we know is very, very busy. That's just common sense. I don't know how many of you have been in an ambulance recently, but I can tell you, you want to go where there is capacity to treat you. That's the system working as it should. To every ambulance paramedic, to every nurse, every doctor, every cook, cleaner, every ward clerk, they're all doing their very best. And when you have cases that get into your hospital system, you have to furlough. You've got to take that risk away. The last thing I want is to have what the New South Wales government are dealing with at the moment, where people have gone into hospital for not for COVID, but for all manner of other treatment, got COVID in hospital, and some of those have passed. They have lost their life because of that. So furloughing is very, very important.
But as a result, are Sunshine and Footscray hospitals not struggling? Is that what you're suggesting?
No, I'm not suggesting that at all. I don't know how you could possibly interpret what I just said as saying that. Though some of our hospitals will be under significant pressure, and we work with each of those to provide extra staff, extra resources, to distribute patients to less busy parts of the hospital system. That's the point that I'm making.
Can businesses anticipate?
And if you think, and just before we go to that, and if you think, whether you're a union leader, whether you're a politician, a journalist, or a punter, if you think our hospitals are busy now, I'll tell you what happens if we don't keep this lockdown on, as challenging as it is, as difficult as it is. We'll just finish up overwhelmed. And then it won't just be some ambulances going to a different hospital because that's where there's some capacity as opposed to the local, which is very busy. It'll be every hospital will be incredibly busy, and people who have terrible accidents, people who have non-COVID related emergencies won't get the care that they need. That's what we're trying to avoid. You're about to ask me about business support, I'm certain I heard.
Yes.
Yes.
Can they anticipate further financial
As
support?
early as tomorrow, the Minister for Industry Support will come out and talk about further support.
Jerome had mentioned that one of the mystery cases is a child in Melbourne, but they were identified as a primary close contact.
Yep.
Can you maybe go through the details? If they've been identified as a primary close contact, how are they a mystery case?
It's the child of a positive case.
So how's it a mystery case?
Well, the original person is a mystery case.
Okay.
So to be a primary close contact of a mystery case means you're linked to that mystery, but the person you got it from remains a mystery. Sorry if that wasn't clear.
And the Mini Valley traffic controller, which was a mystery case a couple of weeks ago when we got out of lockdown, they had a couple of exposure sites in Newport. Do we believe that's where this particular cluster originated from?
No, we don't. We can't conclude one way or the other at this stage. We're still doing more testing, more of that detective work, and it may be that as further cases come forward and they tell us their story and we're able to track and map all the crossover points, we may solve some of these mysteries. Sometimes genomics solves it for you really fast. That hasn't been the case here. We know what it is, we know where it's from, but we don't know the circumstances in which it's circulated here. So we may get clarity or we may not. That's why we call them mysteries. Some of them are solved and some of them aren't. But it's always better if we can run them to ground and have total certainty about where the person got it from, because that means we can have greater confidence that we've got the whole chain of transmission and we know about each and every link. That's not the case at the moment. Hopefully that will be the case as we continue that important work.
Do we have any working theories on how the doctor at the Royal Children's Hospital contracted the virus? They're obviously a long way away from the western suburbs.
I think it's a little early for us to I think the answer is we're still going through interviews, we're still going through all of that work. And we don't necessarily have an active theory yet. The moment we do, though, the moment we can share with you any links that are kind of jumping out at the team, we're more than happy to do that. I think there's probably we would hope that there's some crossover points, whether it's the same public transport or having been in basically the same space at the same time as somebody else. I don't think it's knowing transmission. I don't think it's necessarily somebody that they knew they were in the company of. So it may be one of those rapid or fleeting transmissions, and they're always really hard to run to ground.
Premier, if the supply of the AstraZeneca jab isn't an issue, why aren't all state-run hubs giving that to under 40s, given we've seen the demand is obviously there?
Well, Bridget, we started with basically 0. Then on Sunday we announced we'd stand up 9, plus the Melbourne drive-through as well, just as a new model. They've been very, very successful, and I hope in the next couple of days I can announce many more than 9. And then we can all work together to get as many people through those clinics. But the 9 have been, it's best to start, if you like, slowly and build that up. It has certainly built fast, and we've been not surprised, I have to say, but very pleased to see so many people come forward and book some of those clinics out, some of those appointments out right until the end of this month. You know, I think that there's nothing wrong with us having a proper examination of who's hesitant and who isn't. But I sometimes think the vaccine hesitancy conversation is kind of a conversation amongst ourselves, out there in beyond our world of press conferences and policy, but in real practical terms, I think there are many millions of Victorians who want to get vaccinated, and they want to get vaccinated like yesterday. And the strong response to those extra clinics offering AstraZeneca and eligibility from 18 to 39 in just 3 days, I think shows you how keen so many people are. So we'll grow that. And then I think we'll have many, many hundreds of thousands of people come forward and get vaccinated who would have had to wait longer.
Just on vaccination.
Pardon?
Will you target the western suburbs where the need at the moment is obviously the greatest?
I think part of expanding it from 9 to a higher number will mean that we want everybody, no matter where they're from, to be able to, if they provide that informed consent after speaking to a doctor, and there'll be a doctor at the clinic, at the state hub where you've booked your appointment. We want that to happen across the board, and it would seem that that's exactly what's happening now.
Just on vaccinations, it would seem, according to fresh figures, that Victorian GPs are falling far behind New South Wales GPs when it comes to administering the vaccine. Why do you think that might be?
Yeah, I don't have a theory on that. You'd need to probably speak to Greg Hunt about that. The primary care partnerships, that is to say the primary care arm of this, GPs don't report to me, they're not paid by me, they're organised and coordinated by the federal government, so I think Minister Hunt's probably the best person to talk to there. What I can tell you is our state clinics remain the strongest in the country, and we want to grow that and make that even stronger. That's what the AstraZeneca announcements were about on Sunday. 9 clinics, 18 to 39, thousands of appointments that have already been made. We want to grow that, and we will. What happens in community pharmacy and GPs surgeries is a matter for the federal government, although I will say I think there are some opportunities for us to partner with pharmacy as well. We'll have more to say in this space quite soon.
Just on Minister
I'm not passing the buck. I just don't have an answer because the GPs don't speak to me. They're not run by us.
Just on the federal government's AstraZeneca vaccination insurance scheme for GPs, is there any concern on your end that still hasn't come to fruition?
Again, there's lots of things are said. People have lots of views on different things, but they'd only be chatting to me. They're not talking to me for an outcome. So I have heard that from some GPs, but that's very anecdotal and not really. I'm not really the person to answer that. How meaningful or otherwise that is, I'm sure Minister Hunt would be in a position to talk to that. I know a bunch of GPs in my own local community. I've talked to them. Some of them are very, very busy and they're doing a lot of this vaccine work. Some of them are less busy. I can't quite put my finger on why that is. It's not my job to, but if we can help in any way, obviously we will. But I think the best thing we can do as a state is to continue to vaccinate more people in our clinics than any other state. And in the next couple of days, I'll have some exciting announcements about expanding that program even further.
In terms of rolling out the
mystery cases today,
You actually created your own language then, like you're all talking at the same. Anyway.
Given the demand at state-run hubs,
yes.
would you consider opening up appointments for the rest of the year?
We'll have more to say about opening up appointments soon. With the supplies of AstraZeneca being as plentiful as they are, given eligibility is now expanded, we will go from 9 to a greater number of state hubs that offer it. You can book with absolute confidence that you can get your first jab, come back 12 weeks later and get your second. And if you're done now, if you're through the program now, then you're not going to be in a really long queue in another 6 or 8 weeks' time when a lot of other supply gets here. If your doctor says it's safe, then, as the Chief Health Officer said many times, the best vaccine is the one you can take today. And that's the biggest contribution you can make to not only your safety, the safety of your family, every family, the jobs of every single Victorian depend on all of us getting vaccinated to the 70 and the 80% and hopefully beyond, so that we don't do lockdowns anymore and we can resume our jobs plan and that amazing performance of the Victorian economy. 6.5% growth, 250,000 jobs, a bounce back like no other. We want to get back to that. Getting vaccinated is the way we do it.
In terms of rolling out Pfizer to 40-year-olds, essentially Victoria went alone despite it being a Commonwealth program. Given the transmission we're seeing at schools, do you think it's time to prioritise teachers? Whether it is for Pfizer or whether it is for AstraZeneca. I know with paramedics, for example, and with aged care workers, we sent them to the front of the queue a couple of months ago.
Yeah, we did. And they're not only frontline, they're frontline healthcare. So I don't think anyone's quibbling with health professionals having been put at the front of the queue. I've made the point, or I've tried to, and maybe I haven't explained it very well, but I just repeat for you. I reckon there's 1,000 different groups out there in the community who right now can make a compelling case, a really powerful and strong argument as to why they should get priority. Problem is, it isn't about how worthy their arguments are, it's about how much stock we've got. I would just make the point that 60+% of teachers and staff in our schools are already eligible by virtue of age. They will benefit, I think, from the additional Pfizer appointments we've got up online at the moment, the additional AstraZeneca appointments we've got up online, and some of the announcements we'll make in coming days. I'd commend to each of them. You've been made a priority. You've been made a priority. You've been made a priority already in the program, and I'd encourage you to go and get vaccinated.
when do you think we'll have capacity to expand past the 9 hubs for AZ?
I'll have more to say about that soon.
And also, when it comes to Pfizer, given that young people are soon going to be eligible to get that jab, will you be opening up bookings ahead of time, or will we just focus on AZ for the meantime?
Look, we'll have more to say about the whole system soon. The priority is going to be about getting more people through that AstraZeneca process, because we have many more. Supply is not such an issue there. I've been really encouraged by the number of people that have come forward just in the last 2 or 3 days, and we'll build on that with even more sites where people can get access.
Also, the New South Wales Premier's promise to open up further when 50% population gets vaccinated. Does that mean we're going to be restricted to travelling to New South Wales if that happens?
Yeah, look, I'd let the New South Wales Premier speak for her government's intentions and speak for herself, but I interpreted what she said was not so much opening up at 50%, but some of the rules could change at 50%, which I think I would not see that as opening up. It might be a whole lot of stuff you can't do at the moment that you might be able to do. But I would also say I'm a bit confused, frankly, because that's not what Dr. Chant said yesterday. So you might have to seek some clarity from them. They might need to clean that up a bit. I'm not quite sure what their settings are. But everybody in New South Wales should get vaccinated. Everybody in Victoria should get vaccinated. It's our way out of this. As for clarity about what their intentions are, you'd probably have to speak to them.
On the 5 mystery cases,
yes.
Is that the reason the lockdown is 7 days? If we didn't have those mystery cases, could the extension have been shorter? Are the 5 mystery cases the reason for 7 days?
The advice is an extension for 7 days, and that's the position that the government's taken. Mystery cases are always a concern.
Caroline Springs Shopping Centre be closed for 14 days?
Sorry, what was that?
The Caroline Springs Shopping Centre, that's been listed as a Tier 1 site for some staff. Will that be closed for the next 2 weeks?
I've got about half of that, I'm afraid, Samaya. I might let Jerome speak to exposure sites. Well, no one else can hear me. No one else can hear me. It was an amazing contribution you're making up there.
Sorry, Samaya. I think the question was Caroline Square, is it being closed?
Yes, will it be closed for 14 days or just for a few days until it's deep cleaned?
Right, good. We'll give this a go. So with regard to Caroline Square's shopping centre, we spoke to all the retailers yesterday afternoon, the centre management and, of course, local council. I think all stakeholders are being very supportive. There are 3 days between the 2nd and 5th of August where all staff who worked for those 3 days are regarded as Tier 1 primary close contacts and are isolating. The centre has been deep cleaned, the stores have been deep cleaned, and those retailers that can bring alternative workforces into bear will, of course, be able to trade normally. I stress again, Caroline Square Shopping Centre is safe to use now. The retailers will be working on ensuring that they've got clean staff to operate within there, and that will they'll make those arrangements individually.
That's obviously been closed for the next 14 days.
That's right. Well, yeah. So we spoke to the principal at Bacchus Marsh Grammar yesterday, look, as a precautionary measure, and we're very grateful to his support and the support of that whole school community. It is closed at this point in time for online learning. We will continue to review that situation, of course, but at least for the next 7 days while we continue the lockdown here in Melbourne. Bacchus Marsh Grammar has been asked to close, and they voluntarily agreed to do so.
I'm sorry, the staff or the students, they don't necessarily need to isolate for the next 14 days.
So the restrictions that apply to the staff and students at Bacchus Marsh Grammar depends on where they live. Of course, those staff and students that live within the metropolitan area are with the same restrictions that apply to all of us, including the gentleman up on the platform, and those who live in regional Victoria will apply to the restrictions of regional Victoria. If I could just quickly talk briefly to testing and just add to the Premier's comments earlier, we are continuing to see good demand and people coming forward for testing. Testing times yesterday in the western suburbs on average were 1 hour, just over 1 hour. They are busier this morning, and we have seen through our long experience now of running testing responses, it is always busier in the morning. So those people who are sitting and looking at 3-hour queues for testing this morning, please check alternative sites across our network, more than 200 sites. Do check again early this afternoon, late this afternoon into the evening, as many of our sites are open till 8 p.m. We opened up a number of additional sites at Caroline Springs yesterday and the day before. I think there's 3 sites now operating around the leisure centre. We're opening up another drive-through at Keilor Park today, and we will continue, of course, to open up testing as and where it needs to.
And Jerome, yesterday you said 400 Caroline
Caroline Springs had been tested.
Yep.
Do you have a figure on today from yesterday?
I do. So we have 1,200 people who were tested at Caroline Springs yesterday, so a really good uptick. We've also seen 20,000 people get tested in the city of Melbourne LGA over the last week, so a really strong response from residents of the Melbourne area. We'd obviously like to see those numbers continue to rise over the coming days, but that represents about a threefold increase on the rates we were seeing the previous week.
How confident are you that the Altaqua school has been adequately tested and you have negative results in their space?
Look, we've seen a phenomenal response from a number of schools in this outbreak, including Altaqua College, including Mount Alexander College, and a number of other schools we've been talking about. We're now at sort of 88-90% testing return, negative testing returns for all of those schools, and the school community continues to do a fantastic job in supporting each other and supporting those that continue to isolate for 14 days. As I mentioned earlier, we've done over 1,000 home visits, most of those to primary close contact. They're all isolating, they're all doing the right thing. And a quick shout out to the Red Cross in particular. We've got 275 families that are being supported with welfare and food packages at home as they continue to need that little bit of extra support to isolate. And anybody who needs support, please come forward and ask us. We are there to help you isolate safely and effectively.
Clarifying there, you said that 1,200 tested in Caroline Springs is threefold on yesterday?
That's right, yeah, so 1,200 in Caroline Springs yesterday at those local centres, and of course many other people have got tested at other centres, but that's a threefold increase yesterday from the day before. Mark.
Is that 250 people have been furloughed from Western Health?
Yeah.
How is that? Is that accurate? And how is that impacting your testing and vaccination capacity out west?
Sure. So with regard to Western Health, my understanding of the numbers I saw this morning, Mark, is we have 114 staff at Western Health who are currently furloughed, and they are furloughed because of they've been involved in Tier 1 exposure site. A number of those staff in particular are, of course, parents of children at the schools that we're working with, and of course they are now having to isolate along with their children. And look, my thanks to them for doing that work. Western Health, like all of our health services, have very strong operational plans in place around the furloughing of their staff and supporting those staff through those arrangements to ensure our health services remain safe. And as the Premier said earlier, we will of course make operational adjustments to where we ask people to get their health services to make sure that none of our health services are overloaded.
Is that having any impact on the vaccine or the testing side?
No, not at this point. I mean, we've cleared it. There's Russell and his team at Western Health are doing a fantastic job juggling a number of different demands. It is absolutely entirely possible that we'll reallocate some of our vaccination and testing staff as necessary. We'll bring them in from other centres. So at this point in time, this is the kind of contingency plans we have in place. That's what we plan for. That's what we work to.
Just on authorised officers, particularly doing home visits, we've interviewed someone who says they were approached by someone claiming to be an authorised officer and then asked them to perform sexual acts to get out of hotel quarantine. I don't know if you're aware of that case, but how confident are you in security, and do you have any update on the investigation into this?
Oh, thanks, Mark. So let me first say I'm aware of a police investigation into someone impersonating an authorised officer and seeking to enter into the home. That must be an incredibly distressing and frightening experience for the individual concerned, and I extend my sympathies to her. Let me be very clear. Authorised officers, when they make home visits, there are three things we should all be aware of. They will always be in uniform. They will always have appropriate identification, and they will never, under any circumstances, seek entry into your home. So please, if you're being visited as part of our home visit program by one of our authorised officers, ask for their ID, check their uniform, and if they're asking to get into your home, shut the door.
Police believe that the information that individual had on an iPad was legitimate. Police believe that the information that individual had on an iPad was legitimate. Was it so on your end, do you believe? And if so, how did he potentially get that?
Yeah, so Mark, look, that is clearly subject to a police investigation. We're working very closely with the investigation team. I can't comment on that active investigation at the moment.
Given we've had a lot of transmission, obviously, in shopping centres, schools are a bit precarious as well, are you confident with the level of ventilation at shopping centres and schools? And do you think moving forward there needs to be an assessment in those particular settings?
I think we've got a huge bit of work to do with ventilation across the board in so many indoor settings. The reality is there are tens of thousands, hundreds of thousands of indoor settings that need infrastructural change in order to be well ventilated. That can't happen overnight. It can't happen in schools overnight. It can't happen in restaurants. It can't happen in shopping centres. They need to do whatever they can to improve ventilation. through opening doors, opening windows, HEPA filters we've talked about that use high filtration to take viral particles out of the air. That's part of the solution. CO2 monitors will be part of the solution. We've had those conversations with Cabinet and with some of those sectors, but that's a huge piece of work and it can't happen everywhere instantaneously. Our IPCAR team go out and do assessments for particular places where there have been transmissions noted. And they will feed back to us if there's a real ventilation issue. They've done it in apartment buildings, they'll do it in some of those other settings, and if there are some temporary uplifts we can do to ventilation, then we'll do that. That might be introducing air scrubbers or air purifiers, for example.
How quickly could that be brought into some of those bigger risk areas like the shopping centre or areas of the shopping centre?
Look, there are literally thousands of them, so it's not something to do overnight, and something that they need to take some responsibility for, to the extent that they can do it without huge structural changes taking place. But we've got terrific research, guidance online. And lessons from unfortunately, from our hospital and aged care settings where transmission has occurred because of inadequate ventilation and the structural constraints that are, a feature of hospitals across Australia. So those lessons can be applied tomorrow in many places, just using the principles of airflow through some of those indoor settings.
Brett, apologies if it's already been asked, but is a week enough to get this under control and, enough people in quarantine for you to ease restrictions?
I hope so. We never know what the days will bring. We know what will work in these circumstances. If testing is high, if anyone who's symptomatic is getting tested and we can identify those actual cases of coronavirus out there, then we can control them. When we control them, they're quarantining, we get ahead of it, there are no new exposure sites. Every new case arises who's spent their entire infectious period in quarantine. That's what happened in southeast Queensland, that's why they're out of their lockdown now. That's what's happened in every previous outbreak that we've had in Victoria. So we know the principles that will get us there. We need everyone to do that to make sure we can.
So you're comfortable if there's like 10 or 15 cases as long as they're all in quarantine?
Look, I don't want any cases arising, but if they're 10 and they're all in quarantine for their infectious period, I know that's not a risk to the general community. So I'd love to see that. But we do need to know the cases that are out there so that we can take the appropriate actions, find everything, find all those transmission sites to be able to control it.
How many days do we need no infectious people in the community for before lockdown?
There's no magic number. We need as many people to be isolating from right now, but that requires people to be known to us, and that means testing with symptoms. That means to the fullest extent that we can, following those restrictions. If you can do shopping online, do shopping online. If you can do a week's shopping now, rather than go out every day for one or two items, that is much better. You are reducing your risk of needing to go to Melton Shopping Strip, CS Square Shopping Centre. Those are current exposure sites because people go there frequently. If we can reduce the volumes of people going, that reduces the risk of people being exposed.
But we've seen the cases isolating go from 25% yesterday to 70% today. When do you realistically think we could start to see 100% of those?
Look, we're getting there, but clearly with mystery cases, because they were not known, they were not identified as primary close contacts, they will not be isolating. They'll be limiting their movement, as is everyone in lockdown, but they won't be isolating fully because they weren't known as PCCs. So that'll be a challenge. We don't want any more of those, and that's what my call out for testing is, because we find you, you quarantine appropriately, you isolate, and your household and other close contacts can do the same.
I was just going to say, the aim is obviously to have 100% isolating before next Thursday.
That's absolutely right, yeah. Let it be tomorrow if it may be.
Brett, you said earlier you're confident we're getting ahead of it. So I guess where are we placed right now? Are we keeping pace? Have we slipped behind?
Look, we're at the heels of it. When you've got these unlinked cases, it's a concern, but we are very gratified that those individuals tested early and really have the minimum kind of exposures that you would expect during lockdown. So following the rules, doing the best that they absolutely can, getting tested quickly, so that's all good.
Just on the New South Wales Premier, I asked the Premier this question before. Gladys Berejiklian's indicated she'll ease some restrictions when 50% of the population's vaccinated. How nervous does that make you? And also, does that mean that we're going to be prevented from travelling there, say, until the end of the year? Look, it's not a matter for me to comment on what New South Wales government is doing in relation to changing restrictions. As the Premier said, they might be some tweaks to the current restrictions within Greater Sydney. But we will protect Victoria with all of the mechanisms that we've talked about, our specified worker permits, all of our other permit systems, the classifications for zones, the border controls, and the agile roving patrols by VicPol. They are all mechanisms to protect Victoria. To the extent that it needs to go late into the year, it'll go. If New South Wales can get to a point where those risks are really diminished, that'll be great for them. That'll be much better for Victoria, no question.
When are you expected to review South East Queensland as a red zone? Or
every day. Look, they're doing very well. I think it needs another couple of days to see that they are still completely in quarantine, those new cases that are arising. Cairns has only had a few days, but we'll have a look every day and hopefully by the end of the week.
New South Wales is experiencing a wave similar to what we experienced last year in terms of the settings, essential workers travelling, people not isolating, home visits in low SES communities. And I'm assuming you've communicated all of this in AHPPC to your New South Wales health counterparts. Do you know what they've taken on board?
No, look, I don't. All of that information is available. In essence, when we write directions for Victoria, they're all gazetted, the historical public health directions that have been made, and they indicate what our stay-at-home directions were, what our restricted activity directions, our workplace and additional industries directions. So they're all available for New South Wales. What they apply, what is appropriate for their context is entirely for them. I would say policy is one element, engagement's a huge element, compliance and enforcement's another dimension, and the clarity and consistency of communication, they are all elements. It shouldn't just be a debate around what's harsher, what's stricter. It needs to be about what the entire package delivers. There's no question the challenge is more substantial for New South Wales because of a Delta variant. That is absolutely the case. But all of our resources, all of the lessons from Victoria are available. I've made it clear through AHPPC, I've made it clear in my discussions with the Chief Health Officer in New South Wales that whatever we can do to share those lessons and to provide whatever perspectives or advice that we can, as they did for us, I'm very happy to do so.
And I know there's no one particular setting that's worked on its own, but essentially in terms of when we had introduced $450 isolation payments and $1,500 testing isolation payments, what kind of an impact did that have on people's ability to continue to stay at home?
Look, I think we can speculate. We don't know for every single individual. I think it's a really important measure. It clearly supports someone to be able to wait at home for that test result if they would otherwise lose income through casual work, through other work that they're not entitled to a payment for staying at home. They're not sick, they're waiting for a test result. So overall, I think it was an important part of the suite of measures that we had in place.
Brett, what do you make of state-run hubs offering the AZ to under 40s off their own volition? There's one in Warrnambool that began doing it this morning.
Look, I think it's great. Clearly, the uptake has increased. It's sending a message that these vaccines are important for everyone, and if you can get it now, please get it now. We've also seen increased uptake in those 60 to 69 years of age. Now, they're not through the state-run hubs, but I think it's sending a message about, the substantial risk that Delta variant has in Australia right now. We're going through one of the most challenging periods of the last 18 months. The fact that you can get protection from this vaccine right now if you get it, and, to the point about uptake in general practices here versus New South Wales, GPs have delivered more vaccines than any other group in Australia. They are a really critical part of delivering vaccine, and I think the message around AstraZeneca is not just in our state-run hubs that have delivered more than any other jurisdiction through state commission services, but also to GPs. And demand is high in New South Wales because of the transmission there at the moment and the concerns that people rightly have. about the need to get protected now, but I think you'll see an increase in GP practices in Victoria as well, and the numbers will only increase, not just for under 40s, but for all of those getting AZ.
Can there be any spectators at the Geelong, is it Cardinia Park?
Not currently, no.
Professor, do you know if the doctor who we understand works with the Children's Hospital was vaccinated?
No, I don't. No, we can. There you go.
Double dose vaccinated.
As are the vast majority of our medical profession.
Yes. To ignore the elephant in the room right now. I know we don't know what's going up there, but
no, we don't. We don't know if it's even about COVID. It's somebody who I think's wanted to speak to me for some time. I don't know who it is. The point I made before is that whether you support me or not, I will do everything I can to protect you from this virus. Shouting doesn't work against this virus. Interrupting anyone doesn't work against this virus. If it did, like I said the other day, if frustration and anger was effective against coronavirus, we'd all be double dose vaccinated by now, all of us. It doesn't work. People are entitled to their views, that's fine, but you know, whether you support me and my team or not, we will do everything we can every hour of the day to keep you safe. That's the key message.
Premier, there's some Melburnians that are in regional Victoria that have been pre-lockdown, whether it be Airbnb bookings or anything like that.
Yes.
They can't get some services because their licences are in Melbourne, and there's no scope and directions to prove that booking.
Yep.
What's the advice? Are they meant to come home, or what do they do?
I thought we got this the other day, and I thought we were going to take it on notice and try and get you some words. Let me chase that up. I apologise if we haven't followed that up. I know I did take it on notice. I assume somebody from the team would chase that up for you, but if you give me a second chance at that, I'll do it.
Now, if we were being incredibly optimistic and over the next couple of days
Yes.
everyone's in quarantine, I know we don't have a crystal ball, but...
I do not, no.
Could you foresee easing restrictions earlier if everything looks good?
Oh, look, we would all put it to you this way. We won't have these restrictions on any longer than they need to be, and if the situation changes and we get advice to say, look, we've got 100% of cases isolated, what were mysteries are no longer mysteries because we've been able to find some links there, then of course we wouldn't rule that out. But, you know, I think people need to brace themselves for, you know, this is going to be another week, and we're all going to work as hard as we can, and if that's frustrating and challenging, then the best thing to do is to channel that into getting tested if you've got symptoms, following the rules, making the best choices for your family and every family. This is far better than other parts of the country who are not dealing with, you know, 75% of a day's cases being in ISO. They're a long way from that. So that's building, as Bridget noted before. That's growing. To have 14 of the 20 locked away is really, really good. But the problem with it is that some of the six that aren't are mysteries, and we've just got to run those to ground. And you know, the last thing we want to do is put people's safety at risk, and that's why we'll keep working very hard. And with the help of all Victorians, and I thank and congratulate the vast majority of Victorians who are working with us, we'll get not just alongside this thing, we'll get out in front of it, and then we'll be able to open up again.
How many days do you want to see with no infectious in the community?
Can we just ask about footy really quickly?
Footy?
Can we rule out crowds in Geelong this weekend? And
There'll be no crowds in Geelong.
Can you envisage a scenario similar to a few months ago where Geelong residents, being regional Victoria, will be allowed to go to footy before those in Metro Melbourne? And finally on footy,
yes.
Finals are coming up.
Yep.
What are your discussions at with the AFL regarding crowds for finals in Melbourne?
Yeah, I'm not having discussions with the AFL myself. Martin Pakula will be. There's an events framework where we work with not just the AFL, but you know, the NRL, everybody, all of those different sports, as well as live theatre, the whole range of different events. It's too early for us to say what those events will look like even next week, let alone beyond that. But we work, the public health team work with the events sector to try and make sure that events happen in a safe way, and that if we can have crowds safely, we will. But it's a bit early for us to forecast that. In terms of there being different settings, well, again, if it's safe to have different settings, then we probably would. But it's just a matter of doing whatever is safe and making sure that in none of the decisions we make, both as a government, as a political leader, right down to the individual decisions that every single Victorian makes multiple times a day, we've got to make decisions that don't contribute to the spread of this.
Sorry, Premier.
Yes.
Minister Foley said yesterday he was seeking advice on the New South Wales woman that's trying to get to Melbourne to care for her daughter going through chemo.
Yes,
Any
yes.
update there?
No, there is no update there. And I just make the point, this is very, very challenging, very difficult. I'm sure that family would want to be close to each other at what is a difficult time. And we of course wish the family member who's experiencing cancer, we wish them well. But we have obligations to every single person, and particularly people who have got an immunocompromised, they've got a health issue that compromises their immune system. We've got to be very, very careful to support them. But there's a lot of difficult choices. Whenever you draw a line, even compassionate cases are really, really hard. And I have no joy at all. I don't like locking Victorians out of their state, and I don't like locking Melburnians into their homes. But I have no alternative.
Has the intervention from the New South Wales Health Minister done anything?
The
intervention of the New South Wales Health Minister on this particular case, we know that he's spoken to the woman in question personally, and he said he would follow up with our Health Minister. How did that discussion go down?
I'm not sure. They speak quite regularly, Minister Hazzard and Minister Foley. It's an important relationship to share information, but I'm not sure whether they've spoken on that matter.
Premier, just a very quick one on fines. There's in the news today that a lot of the fines for breaching the Chief Health Officer's directions haven't been paid. Yes. Is the government going to continue chasing them down, or will you continue?
I think the Sheriff will chase down all of those fines, as you would expect her to do. The key point here is that police already exercise significant discretion in the issuance of fines. I make the point to every Victorian, there are many more warnings that have been issued than fines. So fines are issued where that is appropriate in the context of it could have been a warning. The decision was made not to make it a warning given the seriousness of the breach or the risk that was posed to the community. All that discretion has already been exercised. There's no further discretion. It's not optional. If you've done the wrong thing and you've been not warned but fined, then you need to pay that fine. And if you don't, the Sheriff will be knocking on your door, as is fair.
Another protest planned for tonight. What's your message to people?
Protests don't work against this virus. Screaming and shouting doesn't work against this virus. Being frustrated and angry, I understand that. I get that. Absolutely. As I said before, if it worked, we'd be long vaccinated, But it doesn't. It just doesn't. And this thing's changed on us. It's Delta. It's not what it was last year. It's a different thing. The only thing that works is us following the rules, playing our part, looking out for each other, and getting tested as soon as we have symptoms. That's what works. It's worked here before. It'll work here again. I'm so proud and so grateful of all of those Victorians, the vast, vast majority who, despite the difficulty of this, they're doing it because they know it has to be done. I couldn't be more proud of every Victorian for the part they're playing in this. And if there are no other issues, very good. We will see you soon.
Thank you.
That was